For this keynote session of the Covering Equitable Community Development Fellowship, we'll hear from a man who has risen to the very top ranks of his profession in the field of medicine. He's a board-certified urologist with more than 20 years of surgical experience. And as a recent past chair of the American Medical Association's Board of Trustees, Dr. Willie Underwood has served on countless boards and commissions, and he's authored more than 120 peer-reviewed publications. But when I saw Dr. Underwood speak about health equity at the National Association of Black Journalists Conference in August, I realized that I was not only seeing a medical professional talk about health equity, but I saw someone who is almost a visionary. And I say that in a very authentic way, because someone who has seen the challenges in the American health system as he has, and as a man of African descent in that mix, his vision for what is possible is very positive. It's very almost attainable if you listen to him long enough. But when he explains the need to keep a historical context on the challenges to health equity in America, I'm sure you will agree that this is the perfect sort of launch conversation for us to have in this training. And I should also tell you that you may be looking at the next president of the American Medical Association, because he will be formally running for that role. And so as you're working on stories over the next year or so, you now have exclusive access to someone who will not only teach you about health equity, but someone who's very committed to a vision for health access for all Americans. So it's my distinct pleasure at this point to introduce you all to Dr. Willie Underwood.
Now don't make me cry with that introduction. Thank you. Here I'm gonna, because I want us to have, because I want to start off with some introductory words, say a little bit about me, say some things, but I also want to make sure that we have time for a conversation, because I think that that's where sort of stuff come out, and I say things that I wouldn't normally think about putting in a talk, that they just sort of come out. So first of all, thank you for that wonderful, wonderful, wonderful introduction. As Rick stated, I'm Willie Underwood. I'm a urologist from upstate New York. I live in Buffalo. I practice in this little small town of Elmira. For 20 years, I was in academia, practicing at University of Michigan, Wayne State Carmanos Cancer Institute, and Roswell Park in Buffalo. State immediate past chair of the American Medical Association, and I'm going to tell you, this is an honor to be here, but most of all, I consider myself a clinician scientist. As you stated, the 120, but also includes abstracts, book chapters, non-peer review stuff. I think in there is about 85, 86 total peer review publications. Most of them are around health equity. A lot of the other stuff I write about is basically what I'm going to talk about. How do we create a better healthcare system that works for, how I describe it, not for some of us, SOME, but for the some of us, SUM, because that's what's extremely important. So clinician scientist, I'm an entrepreneur. I have a biotech company. I work with other companies to how we bring innovation, healthcare, and also a social change agent. And I'm going to explain to you how I became a social change agent and why I remain a social change agent. Okay, so thank you for the work that you do, because basically you're not just here representing you, you're here representing basically people that listen to you, that read your stuff, that want information, and they hear it from you. So your voice is the voice of knowledge, wisdom, and understanding from their perspective. So being here, you're like, hey, if I'm going to be that voice, then maybe I need to understand what I'm saying so that those individuals hear the voices correctly. They receive correct information, right? And that's extremely important. And I'm going off script a lot here. I want to thank Rachel Jones. She was, again, the National Association of Black Journalists. She was there. We gave a talk talking about the West Side United and building economic development to improve health outcomes, which was great. So I'll tell you a little bit about me. I'm going to totally jump off skip here. Look, so I grew up in Gary, Indiana. Okay, right? So Gary, Indiana, Still City, was the murder capital of the world. That was after I left. I had nothing to do with that. All right? So, you know, when steel industry went down, a lot of stuff happened there, right? So a little bit about me, and I'll tell you the history of Gary, because that's history is a part of America, and it plays out in the health of our community. So in 1973, right, or 74, the Supreme Court said that it was unconstitutional to deny black people access restricted covenants, right, and property and land. So part of Gary along the lake had all restricted covenants. So you can live next to the steel mills, but you can't live on this part of the lake, right? So it's in the newspaper, no joke. This is absolute truth. They put it in the paper. My mother jumped in a car, drove over there, and bought the first house she saw, which wasn't actually close to the lake. But it's right. It was on the corner next to a church. She saw it, and that's the house. She said, we're going to move in there. It took about a year to do it, but that changed my life. And I'm going to tell you how it changed my life. I went from a private Catholic school that was all black, that believed in educating me to make me the best person I could be, to a school that was predominantly white, and the teachers had a policy, we're not educating them. So they took all of us, all the black males in the school, in that third grade class where I started, and put us in remedial classes where I'm now in kindergarten. And I was there under the disguise that I had a learning disability. I have 3 graduate degrees, MD, right, a master's of science and anatomy, cell biology, created biomarker, got a blessing from Pope, right? I mean, all kinds of stuff. But I somehow had this mystical, magical learning disability that just went away one day. Okay, great. So to the 6th grade, so in the 6th grade, I'm a 3rd grade reading level and a 7th and a half grade math level. Why? Because I was teaching myself math at home, but I had a learning disability. Okay, great. So that's one aspect. So now I'm behind my peers. Second aspect of this is that my family decided they needed a doctor or lawyer in the family, and my cousin and I were the same age. So we stood outside the door, my mother, 2 aunts, grandmother, they're sitting in there. My cousin goes in. He says, they want to talk to you. He goes out. I walk in, and then my aunt tells me, doctor, lawyer in your family, and your cousin's going to be the lawyer. And what does that make you? I'm now a doctor. Okay, so why did I tell you that? Because what they did was they put this image in my mind. Now that you see it, if you can see it in your mind, you can hold it in your hand. So that's all they did. They didn't know how to produce a doctor, but they said, this is what we need, and this is what we're going to create. Not realizing that the teachers who were supposed to help them create them was doing all they can to make sure that I end up in jail and not in college, right? But that's another side story. Okay, so side thing, my grandfather lives on the west side of Chicago, which is great. West Side United comes to this place, west side of Chicago. West side of Chicago, extremely neglected financially, extremely. So he ran a gambling place out of there, and he sold alcohol out of it. So I'm there, going from 8 years old to 12 years old, and I'm sitting there, and he made me sit like literally in the front like this. They're gambling there, and it's usually about 20 people or so in there like what we got, and there's people always talking to me. Now I'm 8, 9, 10, 11, 12, okay, right? So let's talk about those people. They're poor, they're drunk, because they're selling alcohol, right? So they're drinking alcohol. They're smoking, okay, right? They use improper English, they use profanity. To me, they smelled, and I'm going, I hate these folks, I hate being here, and I don't want to be here anymore. I'm 8, I'm 9, I'm 10, I'm 11. So at 12, I decide that I'm going to tell my mother. Now, my mother is not someone you told no to and ever lived to tell about it. So this was a big deal. So I go to my mother, we go to my grandfather's house, and I said, I'm not going. And I remember my sister moved away from me, thinking that I wasn't going to survive. So, and she said nothing. She said, okay, and she left. So I told her why. So she left. So then I went out and played. I came back. Because in those days, you didn't have play dates. You just went out and played with people. So I went out and played. I came back, and my grandfather was in our house for that once and only time. So we went for a walk. So we go for a walk, and I tell him, look, Granddad, you should come visit us. This neighborhood is nicer. We live out here with all these white people. Why am I there with you guys? Da-da-da-da-da. So he said, look, I'm running a business. I got to protect my business. I got to be there. I don't have a business without me. But he asked me these questions. I'm going to run to you to the point. What do you be when you grow up? I said, a doctor. He said, why do you want to be a doctor? I said, what do you think I said?
Cure people.
Help people, right? I said, help people. And he said, what people? And I said,
Everyone.
correct. I said, all people. But I thought that was a ridiculous question. And he looks at me and he says, okay, let me ask you this question. If you can't talk to them because they smoke, because they drink, because they smell, because they use profanity, because they don't use proper English, because they're uneducated, because they're poor, then how are you going to help them? Let me explain something to you. Now he's eye to eye, and I'm 12. He's eye to eye. And he says, I make you sit there on purpose because I need you to understand them. So when you're this big time doctor, you can help them, because you can't help them if you don't understand them and how they got there and why they're there. If not, you're going to see them the same way everyone else sees them, because we don't need doctors. We got enough of them. We need doctors who are going to help them. Now, he was the killer. If you aren't going to be that kind of doctor, then I don't need you to be a doctor. Boom. That's it. I'm crying. I'm done. And I spent the rest of till he died as much time as I could with my grandfather trying to understand the situation that we're in. Notice I didn't say they're in, I said we're in. Okay, so that leads us to understanding history. That's why that last talk that we heard was so extremely important, because once you hear those facts, who knew that data before? I didn't. And I'm a semi-historian, right? I've read a lot about this country, a lot about what has happened to all the communities in this country. And none of that I actually heard before, and I'm going to do a lot of work to make sure I understand that, because that's extremely important, right? Having said that, here's the deal. So the west side of Chicago, the AMA working with Rush and some other medical centers got together, and they said, we're going to put together an economic development program for the west side of Chicago. And they started off, the AMA gave $5 million, gave $3 million, at first gave 2, then gave 3. They gave 2, then they increased to 3, now it's 5. And it's over a process. And the other ones gave the same thing. So they started off part with about, I don't know the exact number, but maybe 30, 35 million. Okay, now it's 175 million. They've created over 100 companies. They've increased job employment for over 4,500 people, right? And they've raised businesses, housing, work to transform the community. Why? Because poverty and health go hand in hand like white on rice. Until you can fix that, until you change a process where what the teachers tried to do to me was this. If you get a poor education, you get a poor job. You get a poor job, you live in a poor neighborhood. And you live in a poor neighborhood, you die at least 14 years younger than everyone else who get a good education, to get a nice paying job, to live in a nice neighborhood. To me, that is criminal. It's criminal, period. So all my research and everything all goes to my childhood. We need a doctor in our family. Why? Because my family understood that the only way their health could ever be protected if they had me to protect it. We need a lawyer in our family. Why? Because they said legally we can't be protected unless your cousin has the knowledge and the wisdom and understanding to protect it. That's how they thought. And then they said, my aunt, understanding the Kennedys, she understood how that works. You guys know the Kennedy family, right? How they did that. He lined all the sons up, and he told Joe, you're going to be the president, senator, House, right? And then Joe died, then Jack stepped up. You see how that worked? Vision, image. Okay, great. So now, what if we create a different image of people in our society? Different image. Man. And we say, how come they can't have what I have? Whoa. Aren't they human? Don't they deserve it? Shouldn't everyone have the right to sovereignty? I hear that all the time on YouTube. My house, my family, my land. I have the right to protect it. Right to protect my health. But then you say, and they go, well, I don't know what's wrong with you. I say I don't know what's wrong with you. Right? How does that work? In our society, it doesn't. Because if we only read, this is the last thing I'm going to say when we get to the questions, have a conversation. If we only think about the sum of us, S-O-M, then the S-U-M of us dies. If we think of that in a selfish way. We have to look at each other as one. Rules and policy works the same as one. We educate each other as one. We develop each other as one. If not, then we all perish. I went to Morehouse College, where Martin Luther King went. I say that every time I talk, because I'm about to quote him. We must learn to what? Live together as brothers, or learn to perish together as fools. And I think we figured out that perishing together, I hope we have, we might not have, that perishing together as fools is not a good idea, right? What affects one directly affects us all indirectly. I was supposed to tell you why I went to Morehouse. That's why I went to Morehouse. All right, let's rock and roll.
I'm kind of scared now. I mean, I thought you were inspirational in Chicago, but wow. So I want to continue on this theme of history and understanding the historical context. And one thing that a friend of mine recently reminded me of was the Flexner Report.
Yes.
How many of you in this room have heard of the Flexner Report? No one? Why don't you help us understand, when it comes to, because as I've mentioned to you in Chicago, in this atmosphere of anti-DEI, and, you know, let's not talk about the past and whatever.
As I kick you with it.
Yeah.
Okay, great.
Tell us about that and how that fits into this conversation of equitable access.
Okay, so medical schools, so the way Flexner wrote, now Flexner's brother worked under the Rockefeller Foundation, so, you know, there's a whole like a political thing here, but, and you know, the idea was that medical school education, quote unquote, was the Wild Wild West. So it wasn't a clear definition how everybody being trained. So
This was the early 1900s,
yes.
1920s.
Yes, correct. I was trying to remember the exact year, but I couldn't. But I want to put around 27, around something like that. So basically, so we had medical schools that were women medical schools, women hospitals. We had 7 at the time black hospitals, and then we had a numerous of white hospitals. And then a lot of it was so apprenticeships. We had all kinds of stuff like that. So they looked at 2 models, which was one model, and it depends on where you are. I was at the University of Michigan. University of Michigan said it was the Michigan-Hopkins model. If you were at Hopkins, Hopkins said it was the Hopkins-Michigan model, right? Hopkins stole from us, you know, Michigan people, right? You know, they did. Okay, great, because I'm the Michigan guy. Okay, got one of my degrees in there. So And it was 2 years of basic sciences and then 2 years in the clinics. So then they went to close all the schools that didn't do that. Okay? Now, here's the interesting thing. 5 out of the 7 black medical schools had that exact same model. But Flexner said what? They are what? Inferior. They're not good. So they closed them, only leaving 2, which was Howard and Meharry, right? So that doesn't change, right? So now we got 4. So we didn't get a third into the 1980s. We didn't get a 4th into the 1990s. So that impact changed the number of things. And then at the same time, what did white medical schools say? You ain't coming here. Right? You ain't coming here, so you can go. I don't know where you're going to go, but you got to get out of here. You ain't coming, right? So even schools, but there were medical schools that historically had black students, like the University of Vermont. As time went on, in their first class, they had a black student. SUNY Upstate, where I went, in one of his early classes had a black woman. So, but you saw over time, it became 0. Why? Because of Jim Crow growth, discrimination, all these things that expanded, not just from the South, but was it the North. It was, as Malcolm X said, you south of the Canadian border, you south, right? So all of it was an international thing. So now you have black physicians not being produced, and at the same time, white doctors are able to say that they're inferior. Their hospitals are inferior. So as we're building hospitals, right, blacks weren't allowed to have access to those resources. So then they say, well, hey, I compare your hospital, like your house. I ain't giving you no money. I ain't helping you. But I'm going to compare to this thing over here that we've given a whole lot of money to and we've developed and say, see, you ain't like them, so get out. And then at the same time, you can't go over there. All right. So, yeah, so the Flexner report, that's the damage of it.
So I invoke that to say, when you're doing stories in 2024, about health outcomes or life expectancy on one side of town versus the other. There are 100 conversations to have about what's going on or why this is the case, but put it in that historical context.
Correct.
Generations of communities that perhaps in the late 1800s and early 1900s, there was a black doctor there.
Correct.
There was a clinic that the black community could go to. The Flexner report, and again, put this on your list and look it up, came along and decreed that there are these sets of standards that we think should be followed. And again, 5 out of the 7 existing medical schools were eliminated because these black-run organizations didn't meet these. So these are the ways that we have to start thinking about barriers to access and barriers to equity.
Correct.
Tell us a little bit more about how the AMA and the West Side, a lot of it was based on what I think one of our speakers tomorrow, tomorrow, Kat Stafford. Okay. She was also on the panel with you.
Yes.
She did the reporting for the Associated Press from birth to death. And just, along different metro stops in Chicago, this side, your life expectancy is 62, but if you live along the North Shore, your life expectancy is 78, so whatever. Yeah. So how did you first encounter that reporting, and how did the AMA decide that we want to be involved in this?
So we created a Center for Health Equity. Letha Maybank, Dr. Maybank, I mean, she's like phenomenal. So she was in the Department of Health in New York. So we hired her. She came in. It was really just getting started. She was at the table, and she came to the board and said, hey, we ought to put some money in this. So I wasn't on the board then. So the board said, let's put in $2 million. And then the board had an influx of some other folks who came in and was like, that's chump change. What are you talking about, right? So the money, the financial thing increased. So, but it was all about us trying to have a footprint on improving health outcomes and eliminating health equity. And the AMA played a critical role in the lack of proper health outcomes for colored people in this nation, a critical role. Why? And it's a simple thing. In 1868, the AMA, Colonel Keller, who was a Confederate colonel, he basically said, ethically speaking, blacks shouldn't be allowed to be members of the American Medical Association. Our ethics compel us to keep them out. Now, what did that do? What that did was for you to get licensure in the state, for you to be able to work at a hospital, you had to be a part of a medical association. So when you couldn't be a part of the AMA, you couldn't be a part of the state society, the county societies, unless some white doctor said, Willie's different than the rest of them, so we ought to let him in, right? Other than that, you couldn't get credentialing. That's why the National Medical Association was founded, right? So docs could contribute, and then they still said, oh, that's an inferior organization as a black organization, so you couldn't get credentials in certain states and certain hospitals because of that. And the AMA played a critical role in that. The Flexner Report was written in the AMA building. You heard me say that, right? It was written in our building. Okay, right? So when I was a medical student, I was offered free membership to the AMA, and my response was, I'm going to say it, exact words. There is no way in hell that I ever want my name associated with that racist ass organization. Now you get to laugh at me now.
Go figure.
Because correct. So because when I saw the potential of what we could do and what they were doing at the time, that's why I joined them, and that's why I ended up playing a leadership role in how do we move these things forward, because it's going back to what my grandfather and my family taught me, grandmother as well, and mother and aunts. So yes, that's why this is important. And we tell that history. Matter of fact, we have a reconciliation task force, truth and reconciliation task force with them on, because we're going to have a report to tell all this history. Right? We apologize in the past, but it's time for all this history to come out, not so we can play the blame game, so we can understand what we're seeing and how we got here, so we can correct it. Because we don't understand what we're seeing, then we can't fix it, right?
Let's talk about the public health impact of racism. That's something that a lot of us have seen those headlines in recent years, and particularly the concept of weathering and how microaggressions and outright racism and all things have an actual imprint on our DNA, maybe. Again, let's get back to this anti-DEI backlash and situation that we're in right now. When you go to talk to medical groups and organizations or whatever, what are you hearing in terms of people saying, come on, we got to get over it, or whatever it is they may be saying about the need to amplify health equity? So
I mean, it goes into science, right? So when I did my first initial work looking at racial disparity outcomes in prostate cancer, it was a team of only black scientists on it was me, and they wrote back that I had an agenda and all this stuff. And the white scientists came to me and said, wow, they were like offended, man. They were hurt. Like down there, a couple of them were crying. We can't believe they said this about us. And I kind of laughed a little bit and said, you actually really thought we were going to write this? And they were going to say, oh yeah, this is true? No, they're going to challenge every aspect of it. But they didn't challenge the science. Because the way the data was done, they couldn't challenge that, right? But what they did was say, we looked this dude up and he's trying to tell a narrative that's not true, which now we know that is true. Okay, great. So that aspect is still there, okay, right? That's one. Secondly, it's that we wrote our report, the AMA, Legal Bay Bank, Center for Health Equity, put out this report on the history of health inequities and racism in medicine. And people called me up and said, you're saying I'm a racist. I mean, I'm out in my yard working. You're saying I'm a racist? Willie, I can't believe this. So I said, I don't have the document open in front of me, but when I go look back at it, can you tell me the page and the paragraph that says you're a racist? I'm looking, Dr. Jones is a racist. I'm going to look for that, because I read it a couple of times. I don't remember seeing that. And he said, well, no, that's not what it says. It says, well, that physicians and organized medicine, due to racial laws and policies, impacted this. Are you telling me that's not true? That you didn't, this policy, you didn't write that policy. You didn't do it, but your daddy did it, and your granddaddy did it, right? But it's a fact. That was the impact that it had. Now, you can own that if you want and say we're talking about you, or you can say, wait a minute, let's fix that, right? So yes, so people still hit us with that. Now, I'm going to tell you what I hit them with. Health inequities cost this nation depends on anywhere from $350 billion a year direct healthcare costs to $450 billion a year when you include loss of productivity, okay? It's going to be $1 trillion in direct and indirect healthcare costs by 2040. We're done if that happens. So we need to figure out how we put things together that change that for the betterment of all of us, right? Because we're paying for these inequities, right? And it's costing us greatly. So if you don't like, as I tell people, you don't like welfare, I don't like it either. So let's create jobs and opportunities for those folks so they don't have to be on welfare. Right? You don't like this? Let's create housing opportunity, build new housing, create jobs, create these things. And all of that goes away, right? That's the conversation we have to have.
So here we are at this moment in history. We know what works. We have,
Correct.
to a certain extent, the data.
Correct.
Although I think Paulie's point about challenges in indigenous communities is that there isn't enough data to sort of build a case around. But we still have these inequities.
Correct.
Black maternal mortality is the ultimate example of that. As much as knowledge as we have, and as much in the past half dozen years or so, the issue has been amplified, it still exists.
Correct. Because it's them, right? It's them, right? You know what I mean by them. It's that so for example, when people come to see me, you know, one of my fellows said to me, "Man, I've never seen this, man. Men come to see you and they cry in your office. Men, they tell you these stories. Like, hey, how do you do that? How do you have these conversations?" And I say, when I look at them, I see my relatives. I see me, right? I see me. And I see that. It doesn't matter who they are racially. I put myself in their shoes, right? So how do I help this person help themselves? Because I see them as a person. That's what my grandfather was trying to teach me. That's what my grandmother tried to teach me. And they did it, so they rest in peace, looking at me going, yeah, he did what we told him to do. Okay, great. But if I don't see you the way I see myself, then guess what? I'm not going to help you get to that place, right? I'm gonna believe, like what an institution, I had back pain, I was paralyzed in the left leg, and the dude tells him he claims to be a doctor and he's seeking drugs. The freaking stupid resident thought that screen that you close had like a sound barrier or something. Right? You're like, you're a moron, dude. Then the attending came in and said, and here's the whole thing, he goes and he's telling this to the attending, and he said, what's his name? And he said, Willie Underwood. He was like, Willie Underwood? You mean like, is he black guy, Willie Underwood? Oh, shoot. We in trouble now. So, you know, he is, you moron. And then they went in and still didn't give me proper care. But it's still understanding that, right? These things, so long as we see each other as other, right, then we will never do right by each other and right by ourselves.
Let's talk about that intersection of policy so that when it comes to the empathy that's necessary to work in communities and organize and create opportunity and equity. But there are so many competing factors when it comes to not only policy, legislation, but economic issues. So in other words, for example, perfect example, when a maternity ward shuts down in a low-income neighborhood, the bottom line is invoked. It's just financially it's not
Correct.
feasible, and we don't have, and the residents don't have the money to pay for the services, so whatever. So it seems as if there's an immutable barrier to equity, that as much as we can be empathic and whatever, in this capitalist society, it's always going to win out. Or is that just a nihilistic perspective?
No, you're right. But I'm saying, look, under capitalism is racism. And I'm going to use this as an example. So, and I learned this watching TV. Okay, so Roots was originally shown prime time. Now we don't know if to watch Roots. So I was in the 3rd grade.
Wait a minute. I was old enough to
you
watch
watch Roots, right? So that's why I say we all
Sadly.
right? So Roots was in prime time television, right? Okay, it was the most watched thing in history, right? Series, number, you name it. I mean, we're talking about going into 2000, like up until like I think the Boston, the New York team, Yankees World Series beat it, right? I mean, come on, people were dying waiting for that to happen. Okay, so, but it was never shown in prime time again. Why? Because people like me at 3rd grade saw it and was like, "Ooh, wow, I didn't know that." White folks saw it and said, "Ooh, wow, I didn't know that." And they said, "We ain't gonna never show that in prime time again, ever," despite opportunity to make money. Okay, right? So you put that, sometimes it's straight capitalism, but under that capitalism tendency, sometimes it's race. And I'll give you a perception of it. And I'll give you an example. I'm sitting in a boardroom with board members for insurance company. So I said, we should do something on the east side of Buffalo. The response was, no money, no mission. Willie, you expect us to lose money? We can't lose money because we won't have money. Then we can't do our mission. So they didn't know who they were talking to. So I said, all right. So I came back 3 months later, our next board meeting, and I showed them the money. I said, by the way, there's 59,000 Medicare eligible people in those 5 zip codes that I'm talking about. And if you had 10% of them, you would have this. If you had 20%, so all of a sudden I heard, Willie, a little while later, someone says, Willie, you know, guys, I was thinking that we ought to do something on the east side of Buffalo because I think it's the right thing to do. No, dude, you smelled the dollars. Okay, so many times they're losing money because we haven't figured out or we don't care enough to provide proper health, education, housing, employment to those people. Me. Guess what? We can't even figure out how to provide health care to people like me with money. With the money. I watched, she's now 16, she was like 12, she had migraine, she goes to the Children's Hospital, and I had an event I had to be at, so I went to the event, and I forgot, right? I wasn't thinking about, so my daughter, my wife, my ex-wife is white, my daughter's, black, right? So she goes there, and I get a call from my ex. Now, my ex don't call me. She hates me. So my ex calls me, and she says, I think you need to get here. I said, but I'm in the middle of this event. I've got people listening to me. I can't, like, if she called me in the middle of something like this, right? I'm like, sweetheart, what's going on? My ex, I don't call her sweetheart, but what's going on? She goes, you need to come. I said, okay, gotta go. So I get to the hospital, and I'm in a suit. I'm sitting there watching them, how they treating my daughter. And all I can say was, God, help me. Sit in this chair. Think. Don't react. Think how they were talking to her. My daughter on those standardized tests scoring the 99th percentile. She speaks multiple languages. She's a superstar. And they're talking to her like that. And I wanted to snap their damn necks. But I ain't do nothing. I got up. I called. I sat on the board of insurance company. I called the medical director of the insurance company. It's 9 o'clock at night. He calls me back. I'm in tears. I said, I need the #1 pediatric neurologist to take care of my daughter right now. He goes, that's Medvig. We went to school together. Let me call her. He calls me back and says, she's out of the country, but she's going to take care of this. So I go back in the room and sit down. All of a sudden, they come running in there and go, oh, we didn't know that you were a Dr. McVig patient, and we're going to get you admitted, and we're going to get you what you need, and we're going to take care of you. And I'm going, well, how come you just couldn't do that? Now, guess what? I could afford cash to pay for her health care, but we got insurance. They don't care. What they saw was her. They didn't even see me. They didn't say, who this black dude sitting in there in that expensive ass suit looking at us like he wants to step our neck, right? So they can't even figure out how to take care of me or my family. And that's important, because if those stories are not told, then people can't understand the outcomes that we see.
If there are questions, please get them ready, but I did want to add one experience that I had reporting on maternal mortality for National Geographic. Wrote a story for their January 2019 global health issue, and I got to travel to Somaliland and meet a legendary midwife, Edna Adan Ismail. But I also spoke to a lot of folks in the U.S., and I had the opportunity to go to a labor and delivery ward at a DC hospital. I won't name it. But there was a young white woman in one bed and a black woman in the other bed. And the group of doctors, interns, whatever, came in, and they first went to the black woman in the bed, and I'm standing there, and they know that a reporter from National Geographic is in the room. And they go over to the black woman and give her a poke or two, and okay. Spent maybe 30 seconds looking at her. And the whole team enveloped the bed where the young white girl was. And they were wiping her brow. And they were, how are you doing? Are you okay? What do you need? Oh, it's going to be fine. It was like, and I had an out-of-body experience.
Yeah.
I thought, you know?
Yeah.
So these issues and how they fuel or feed into healthcare and access and equity are very real. We have a question here. Let's get the microphone.
Yeah, so as you get in the microphone, let me say this too. So if you sit down with those individuals, and at no point am I saying that they're bad people, am I saying that they understand what they're doing? It's systemic. So you see the world the way you were taught to see it. I'm an example of what I was taught to become. Look at my research, you look at my writings, look at what I do. I grew up in a political family, right? So we talked politics. I understood how things work, so therefore I do that, right? I understand business because I was taught that. Right? I had my first business when I was 12 years old. So you understand these things, so you see the world the way you're taught to see it. So the question is, how do we break that teaching so that we can see the world differently? Go ahead, Brittany.
So my name is Brittany McGee. I am the business health and engagement reporter for the Ledger Inquirer in Columbus, Georgia. So my question, really I had two questions, but when I look at them, I think they're kind of, are all summed up in one, is with the recent attacks on DEI and affirmative action and things like that, do you feel like it's going to be harder to produce more Black doctors in this next generation? And then along with that, because, a lot of people in the Black community have had bad experiences with healthcare, from my own stories, how can the medical community go about rebuilding that trust, especially among Black families that are just like, they won't go to the doctor until they're about to die,
Correct. So you asked two questions there. So one is that we have to reimagine healthcare education, and our healthcare unit, that's what they're doing, trying to reimagine healthcare education, reimagine what the workforce should look like. So in order you to get there, though, we got to educate people to why the workforce needs to look that way, and what does that mean for whites if it looks that way. So I'm going to tell you a secret. The majority of the lives that I've helped have been white people, right? And those white people that helped me, that allowed me to help them in ways that they could never imagine. Okay, right? When I say to them, if it wasn't for affirmative action, I wouldn't be here to help you. They go, well, you didn't need that. And I go, yes, I did. Because without that, I wouldn't have been able to get in the game. It's not about helping people who are not qualified. It's allowing qualified people to be able to compete, to learn, to have an education. And then you go back and you say, why was this guy ever in special ed? And if he was in special ed, and they tried to do the same thing to my daughter, if he was in special ed, how many of those other people are like him? But they were trapped, imprisoned by lack of education, right? That's one. So we got to increase the numbers. We got to understand why we increase the numbers. And the AMA plays a critical role in that, but so do we. We play a critical role in that. Okay, right? Because when people start to ask, how come we don't have any black doctors in the community? We got community 30% black, but we got no black doctors? What the hell? You, CEO, you, president, we will X your ass. Get someone in here who's going to fix this. That changes a whole lot of stuff. I can't do that, but other people can. Now, what was the second part of that?
Just kind of about building trust.
Okay, now,
those communities.
okay, great. So part of that is that once you begin to produce people and you begin to educate people on why there's a lack of trust, there's a whole concept of people believe black people just don't trust doctors, all this kind of stupidness. It's all ridiculous. They don't trust you because you ain't earned it, right? You know, I talk about the healthcare. The hospital is a horrible place, right? I work there. I'm like, I wouldn't let you touch me. What the heck are you talking about? Right? So, and create business models where that actually works. So it's a multi-thing, and you're absolutely right. You know, it's on us to do that, and we have to own that. And that's sort of, I think, one of the roles that many of our board members play, including me, under teaching the workforce, that we got to think about this differently. That's why I use the word working well for some of us, SOM, compared to the some of us, SUM. And that's some kid working around doing math problems, so the word some. Okay, great.
Do you have a question?
Yeah. So this is
Introduce yourself.
my name's Nick Swartzell. I work for Cincinnati Public Radio, and this is
My relatives live in Cincinnati. My sister lives there, my niece and nephews. Well, go ahead.
That's awesome. It's a great city. So this is a problem I run into a lot, and I feel like a really celebrated, accomplished journalist and a medical expert who really knows how to get a message across, I can tell already, might be able to help me with. So as an example, last week, had some research come through my inbox about the link between asthma and redlining. Yeah. And to me, I've reported on housing for a while, reported on the history of redlining. I'm like, yeah, it totally makes sense. I can see how that would be. Looked at the study, looks solid. I'm not an expert, but I'm like, yeah, this looks good, you know? So I'm like, I'm going to do the story. Get the spots ready. They're about a minute each because it's radio.
Yeah.
And web editor slam, so maximum 500 words. My editor's like, so the cohort of kids that they studied started in the 90s, right? And redlining in when? Like 70s? And I'm like, well, redlining never really ended, but officially, okay, whatever. Yeah. And she's like, well, how does this make sense? Like, our listeners are going to be like really confused by this. And I'm like, I mean, it makes sense to me, but like, there are a lot of people out there who are going to be skeptical. And she's like, I get it. I believe the study, but you're going to have people online saying, oh, now asthma is racist and like, you know, all this stuff. So how do we break through that with the little amount of time that we have? You know, like, and I've done long form narrative pieces on housing issues related to redlining and health, you know, and, you know, that maybe has a little bit more of an impact, but how do we, you know, in that minute and a half, if I'm really bad, I can try to get a spot to a minute and a half, like sneak it in right before the broadcast so they can't cut it. But
I hear you. I hear you.
My boss is not listening.
No, I hear you. So you're absolutely correct. So the idea, so number one, the hard hurdle is that the idea that, oh, something happened, a law was passed that said that can't happen anymore, and then it just no longer happened again. That's absurd, right? That's not the case. So and the real underpinning is that it goes to what even Malcolm X said: live in a poor neighborhood, redlining. You get a poor education, you get a poor job, making poor money, you live in a poor neighborhood, the same redline neighborhood, right? So therefore, you don't get it. You never get it, right? So again, how do we step back and we craft a different story? okay? A story that is palatable, okay? Communities that were redlined in the 70s. Auto insurance costs 5 times that in this neighborhood as it does in that neighborhood, right? Those neighborhoods with these criteria have higher asthma. That higher asthma costs this amount to all you folks living over here that you think you're escaping it. This is what it costs you. Now that's a little more work for you. Okay, right? It's a little more work for you. But now I capture me. Oh, wait a minute. Nick, hold up, Nick, hold up. You telling me my healthcare costs will increase because of this story, because something happened in the 70s? Yeah, that's a fact, right? So how do we begin to recapture that so that conversation is not, so we have a presidential candidate that is very good at that. He says stuff to people, and I know what I'm talking about. He says stuff to people, and educated people go, I don't know why he said that. And I go, you know who he's talking to. Because that message ain't for me, it's for some other folks, right? So we have to craft a message that's for certain people and written in a way that they see that it impacts them, because people go from me, I care about me first, then I'll care about we, then I'll care about us. So me first, community second, my personal community, my family, and then us, the rest of the nation. So the articles have to be, how do I touch the me?
We can take a couple more questions.
Yeah,
But
sorry, I know my answers are long.
But I very quickly wanted to say, in a situation like this, Nick, it's an opportunity for you to it's a lot of work, but to tell this editor, I want to do a story about the fact that people think redlining is over.
Correct.
And here's my chance to use data, to use this research as a way to educate.
That's right.
Always look for opportunities to do that.
Correct.
Courtney,
Yeah, so I wondered if,
introduce yourself.
oh, I'm Courtney Harris Bond. I'm a reporter for phillyvoice.com. It's a digital news outlet. And I'm the health writer. I've covered behavioral health as a freelance journalist since like 2016 in the Philadelphia area. But my question is, how tips for getting people who work in healthcare to talk honestly about what's really going on when it comes, say, to systemic racism. For instance, I recently did a story about organ transplants and organ donors, and I could not get people to really say what was really going on, like why there aren't as many organ donors in communities of color, and why people in communities of color have been historically lower on the list and still are, and it's like I'm not going to lie and say I had the right amount of time to do this, but it's like I couldn't get anyone just to say what was really going on or to actually tell the truth. And I don't want to like stir the pot too much, but at the same time you want to tell an authentic story. So I didn't know if you had any tips for reporters about how to talk to doctors and people in health policy, that kind of thing.
So I'm gonna give you a different answer. Okay, great. So I've done some malpractice cases, and this is what malpractice lawyers do on both sides. They tell each other who's a great doctor for certain things, right? And they share that with each other, right? So I get calls, I work with a lawyer in DC, then I get a call from a lawyer from Cincinnati that says, hey, I got this case, and will you read it for me, talk to me about it? Oh, how'd you get my name? Well, I heard that you did this for doo-doo-doo. So once we get those lists of physicians who are willing to do that, and even if they can't answer that for you, they may either say, let me do some research, or let me connect you with this doctor over here, and they will be open and honest about it, okay, and try to help you put that story together. Again, that's a little work, but we do the work when it's one population, and we're lazy when it's another. And I'm not telling you guys lazy, don't get me wrong, but it becomes lazy at another population. So we said, let's get to the real story here, and how do we bring coalitions together like they did in the West Side United to build an economic development program? How do we put coalitions together to get the truth to the best of our ability out there and educate the world so we can create a better place? right? That's sort of what I'm suggesting.
We have time for one more question, if there is one. If not, one of the things that I'm really excited about is the fact that I think Dr. Underwood has prepared us for the conversation tomorrow completely. We're going to be hearing from Aisha Jacob. We're going to be hearing from Kat Stafford.
Okay.
We will hear from someone from the Big Cities Health Coalition. And as you noticed on the advanced reading list I gave you, there are like 20 different links under that session. And again, you don't have to read them all. This is for your future edification and research or whatever. But one of the things that I try to stress in so many of my trainings is the issue of lived experience. And I cannot think of a more powerful presentation along that line than Dr. Underwood's exhortation to us to really keep the people affected by this issue in mind. I don't care whether you're from the West Coast, East Coast, Florida, Illinois, wherever any of you are from, I want you to go back to your communities and think about who has access to dignity, to quality treatment, and why. And Dr. Willie Underwood has done a tremendous job in helping to get us there. So I would like us all at this point to show our appreciation.
I'm going to ask one last thing. I'm sorry, I like talking. No, I'm sorry. No, I actually don't, but because I'm an introvert, if you could ever believe that, but it was beaten out of me. But having said that, also ask yourself the question, why? Why do I see what I see? Why do they live over there? And why do they live over there? And why do they do that? And some of this information is right there for you. Like, so because we don't ever ask these sort of questions. So ask a different question, right? Because that'll help you connect with the people and see where they're coming from, right? I work down in Elmira, the smaller, I have patients who can't wait to see me. And that's what I mean, Trump country, right? But instead, they're not, they're arguing one thing, but on the other end, they're like, we're so glad you're here, Dr. Underwood. When you coming back? We just love to see, because in the end, they're like, this dude is helping us. And I connect with them because I understand them, right? Just like I understand the people on the west side of Chicago and the people in Buffalo. Because guess what? The one thing we all have in common is that we're all human beings. And we all deserve the right to health, to opportunity, all of us, not just some of us.
And as we begin our journey into community development, once again, let's show Dr. Underwood our gratitude.
Thank you. Rachel, this is awesome.